Hey, my fellow cat loving friends. We are so excited because Rita and I, working with behavior, have had a lot of questions about neurological problems that can affect our cats. So we take advantage of the podcast and we find us an expert. And we have Dr. Karen Kline here. She is a veterinarian and she specializes in neurologic issues. And she is here to discuss some of the common neurologic issues that can happen with cats, what that looks like, and what we need to do. We are so excited to talk to her right after this word from our sponsor. Welcome back to 19 Cats and Counting. I am your co-host, Linda Hall, here with my ever gorgeous blonde bombshell, BFF, my ride or die, Rita Reimers.
With the red eyes right now because allergy
I'm
season.
telling you.
Oh my gosh.
Yeah.
It's awful.
Let's go right to Dr. Karen. She is more than
Let's.
just a veterinarian.
Oh, she's a lot. She's
You have a lot on your plate, Dr. Karen.
Yes. Neurologic anomalies is the subject of the day, but there's other things I'd like to talk to Dr. Karen about sometime, like acupuncture. Got a whole bunch of questions for her.
Oh my gosh, would love to. Absolutely.
Oh yes, you've got to come back and talk
Already
about
planning
the
the next
acupuncture,
show.
because I know I
Let's do it.
am. I was
Let's do
reading
it.
this
I have
like,
a
no,
whole
we need her
list.
back. God bless you. Yes, we love it. We
Oh.
learn so much
We do.
from specialists like you that help us in our behavior, because we are certainly not veterinarians, but we need to know when to say, this is above our pay grade, you need this. So first of all, I want to start with the specialties. I'm old, I'm 57. Back in the day,
I'm gonna be 63 this year. Talk to me when you're 60.
Vets were vets. And now we've got all of these specialists, which makes sense because we do for people too. So how is this helpful, and what is it exactly that you're doing?
Yeah, and I think that's a really good question. When just like in human medicine, when we have a certain issue, you go to your general practitioner and they say, gosh, we need to send you to a specialist. And in veterinary medicine, there's a bunch of specialties, like just like internal medicine, neurology, cardiology, radiology, oncology, radiation oncology. So it's a very big corollary to the human situation, but the conduit is your general practitioner. So in terms of neurology, we deal with problems with the brain, the spinal cord, and the muscles and nerves, same kind of thing. The only difference is, our exam on a little kitty cat is going to be vastly different than what we do on a human. But nonetheless, we first want to just get a history and make sure that everybody's on the same page in terms of what's happening with your little furry creature.
Yeah. Right. And I think sometimes the behavior issues, people think it's a behavior issue, and the vet won't necessarily find anything. He might know you need to see a neurological specialist like I had. We'll talk about that later.
Yeah.
But how do people know this is really behavioral versus I really need to get my cat in to see a specialist because I just give up, this behavior is never going to change?
Yeah, really good question. And I get a lot of questions about behavior as well, but some things to look for, especially, if you've got 1 or 2 cats, or if you've got 11 cats or whatnot.
Or 18.
Or 18, exactly. Is whenever I talk to a client about the difference between behavior and neuro, for example, if we see a little kitty cat who's failing to jump well, because kitty cats are really, really agile. So if they're missing when they're jumping, because, some cats are able to jump all the way up on top of the refrigerator, and it's nothing for them. So if they're having trouble with that, or if they're circling in one direction, or if they're losing their balance, we know that probably that's more of a neurologic issue than it is a behavioral issue. And also not using those back legs. Remember, kitty cats will sometimes have underlying heart disease where they can throw blood clots to their vessels in their back legs or their front limbs, and they can present not walking or limping. So we need to be keyed in on those things as well.
I lost one of my cats, my Colby, to a blood clot, clot, and by the time he came downstairs, he died. I couldn't even get him anywhere to get him like that.
Yeah,
and I think kitty cats are very good at hiding things, more so than dogs are. And so many times these things come on so quickly that owners feel guilty about,
Yeah.
oh my gosh, I should have known this sooner. But it's not anybody's fault. It just can happen. So I
Yeah,
think,
yeah.
we just need to give each other some grace as
Well, I
well.
just got
Definitely.
nervous though, because my Dexter doesn't jump well. He never
I was just going to
has.
ask about that. So
He's
Dexter shows
okay.
no other signs of any other problems, but
So
he
should
will
I
be on the
worry?
chair behind her and he's like, and then
Oh,
sometimes he misses the desk. So, we chuckle at him from time to time, but there could be a neurological problem. But
I guess I could.
if it's not affecting in any other way, is it something we need to look into, or is it just he's got an issue?
that's a really good question because just like what Lady Gaga says, born this way,
Yes.
sometimes these guys are born without a certain portion of their brain being developed well. And one of those parts of the brain, without going into anatomy, is that part of the brain called the cerebellum. And I don't know if your listeners or you guys know about the condition called cerebellar hypoplasia, where that
Yes.
portion of the brain doesn't develop well, and it can be secondary to a viral infection. And
Yes.
it's non-progressive. So if Dexter is going about his daily business without a care, I wouldn't worry about it.
Yeah.
Okay, good.
That could be just him. Yeah.
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 He's
We
actually
all
one of
have.
the least cats with the care in the world
Oh,
because
he's
he's just like
sweet.
anybody fusses at him. He's just like, dude, can't we be
Dude, give me a
friends? And he's
break.
just,
Yeah.
yes, he's just the most easygoing cat I have ever seen. Her easiest integration. He
Oh
just
yeah.
like
Oh,
moved in and went hi.
I showed
oh,
up on my
that's what
deck
I
and that
love.
was it.
So
He
that
knew. He
he
knew
did.
exactly what he was getting
He
into.
did.
Yeah.
He
On the
really
other
did.
Cats
hand,
find a
Yes.
way. Yep,
the
Yeah,
little
for
exactly.
sure.
the little
Yeah.
max I took in, he ended up having toxoplasmosis infection of the brain stem, and I had to take him to a neurologist to diagnose. He started having, his front limbs would stiffen. He had a few seizures. Um, Dr. Faber thought massive doses of antibiotic that we might be able to get him through it, but we just couldn't. We had to let him
Yeah,
go.
and
It was
sometimes
awful.
can be overwhelming.
Hmm.
But I think to that point, and this is what's really interesting about neurology is, what I do is first get my client into a room and let the cat walk around. And you know how kitty cats are, they don't sometimes like to be held too much. So it's all about observation and also what my clients really, what their aspirations are in terms of, what they want. Because again, as I had mentioned before, not everybody has thousands of dollars for imaging. So the first thing that I do is get a really good history, but also do my physical and neurologic exams. And it's a routine. I love just doing physical exams and neuro exams, especially on little fractious kitties.
Yeah.
They're challenging. But the other thing about neurology that's really cool is when I see a kitty cat walking around, I can more or less tell what's wrong with them just without laying a hand on them.
I
And
love
then we
that.
go into the rest of our exam because some of these things, we want to look at progression. We want to see if things are getting worse and better, because sometimes some older kitties with underlying heart disease or kidney issues can even get little strokes in their brain, just like we do. So, it depends on the history. Did it come on quickly? Is it getting worse? Is it getting better? And to your point about seizures, not every kitty cat that has seizures is going to have something bad
Right.
because we have a condition called epilepsy of unknown cause in kitties that they're almost like dogs, just in that regard. They have seizures, which are short circuits in the thinking portion of the brain, and they can be managed very, very easily.
Wow, I
That's
did not know
wonderful.
that either.
So, and that was a question I was going to ask you. So, money's tight. I think my cat has a neurological disorder. I shouldn't naturally assume that bringing my cat to a neurologic specialist means I'm going to have to pay for an MRI. It's worth an investigation. There might have been an easier route, and
I
you'll
truthfully didn't
guide
spend a lot of
us.
money because my neurologist was like you. She could pretty much tell what was going on. And then she ran some blood work, I think, and other tests, but it wasn't thousands, thankfully.
Yeah.
Yeah, and I think that's important these days because money's tight well, I always start and I talk with my owners about the basics. So let's get some blood work to make sure there's not a systemic reason for what's going on. And then we can talk about other things later. You know, it's that big exam and the expectations and what your goals are. Because I see a lot of animals that, you know, have non-progressive disease, and we talk about options, and a lot of times there's other systemic or metabolic things like heart disease and kidney disease that can cause secondary neurologic effects. So we always want to start with the basics and then we move on from there. I think that's really important.
That's awesome. I know we're getting close to needing a break, but let me
We
leave you
got
with
about 5 minutes.
Oh, okay, we're good. So a question. So we had a client early on starting off, and we always encourage, because we can't force them, but it's always, did you get a vet check? So she'd been to her regular vet and had been cleared. And this cat was very reactive to noise, which we often see, and we can often desensitize them to that, work
Yeah,
on
but this
that.
was extreme.
This was something we'd never seen before. If this girl coughed, the cat attacked her. If she
Oh,
accidentally dropped a
She
fork,
dropped
I
a
mean,
fork.
can you imagine walking around in this nervous
Wow.
state of eggshells and, oh God, don't drop anything and
Yeah.
don't,
You'd
you
have
know,
to wrap
she was,
yourself in bubble wrap so
yes,
you like
Right.
just
and
not get clawed
everything
and
you
bitten.
own. And
Oh my
the cat
goodness.
had moments of being just lovely. And of course, she was in love
Yep.
with this cat. But
Yeah.
we had to, first time we ever had to say, this is above our pay grade. I'm sorry, you really need a neurologist. And I don't know what happened from there, but
I
is
remember her
that
going
something?
and that it got better, but it's been years since we
Yeah,
talked with her.
I'd really like to know what happened. But so is that something that's fairly common and relatable to something? What does that tell you?
Yeah, and you know, there's a condition, and I don't want to get into the weeds here, auditory seizures, where seizures can come on just out of the blue in response to a noise. So, for example, if you open a bag of potato chips, or if you pop a bubble wrap or
This is
something
my
like
balance charge.
that he's so cute. That could potentially stimulate seizures, and sometimes, especially in kitty cats, aggression can be associated with seizures.
That was going to be
because
one of my questions about aggression.
Yep, because cat seizures are vastly different than dog seizures. Cats will like suddenly attack out of the blue, or their pupils will dilate, they'll vocalize, they'll like run and try to jump up the side of a wall or something like that. So much different. And dealing with a seizuring kitty is a little bit more dangerous than even dealing with a seizuring dog per se, because, you know, some of these kitties have claws and teeth and all that stuff. So
Now you're more apt to get
in
bit or
answer,
scratched.
yep. In
Yes.
answer to your question, you know, there are medicines and so forth and other things to do that we could intervene with. And again, sometimes we'll trial these guys on an anti-seizure medicine at first before we launch into a lot of different diagnostics, just to see if we're on the right track.
That's amazing. That never would have occurred to me in a million years.
Me
That
neither.
it could have been a seizure, right? I thought the cat was just scared to death of everything that moved.
Yeah, and the other thing is, if the kitty is still alive now, chances are more likely that we didn't have anything noxious going on, because God forbid if he had a tumor, that wouldn't have ended so well.
I think
So,
we can
Yes.
find her. I'm gonna have to go back.
We're
and
gonna
look at
have to
our
check up
records.
on her now.
yeah, of course.
Yes. Oh, yes. Yeah,
Oh,
it was a very frustrating feeling. Like, sorry, we have nothing left to give you. You've got to go
Yeah.
see a neurologist. So
Plus,
no,
it's
that's-
scary.
It is scary. Let's take a quick break. And when we come
Imagine.
back, we'll
Okay.
continue talking about this because I have questions. We'll be
Okay.
right back.
Awesome.
And welcome back to 19 Cats and Counting with Dr. Karen Kline, who is a feline neurologist. Oh, I think you do dogs too, right?
Sure do. And an
Yes.
occasional horse or cow.
Oh, wow.
Oh,
When
thought
we're
about
talking
that.
about aggression and neurological issues, I wanted to ask, so many general practice veterinarians are quick to put cats who have aggression or anxiety on Prozac, right?
Mm.
Now, we don't not believe in medication. There's times when Prozac is warranted, and we often say, if there's a neurological issue, maybe the Prozac lifetime Prozac would be a valid option. If it's just behavioral, I think sometimes that gets in the way of diagnosing and fixing properly what's going on. But does it also mask the neurological issue that might be occurring, that you're just gonna, given the cat Prozac and he's acting different, but maybe there was a reason for it?
Yeah, and I agree. And that's where, top of the line, we want to rule out anything else that could be affecting, whether or not, and kitties and dogs for that matter, are just like humans if they're painful. So remember that cats will have an abnormal gait. Maybe they've got osteoarthritis or their muscles hurt. And there are some situations in cats where we'll see inflammation of the muscle that can cause them to be really, really painful. So I do agree that, I hold off on using anything like fluoxetine or Prozac unless, I really have a good reason for that.
Yes,
Because, just like in people, sometimes that can mask the progression of the disease, or there may be some other confounding factor that could, be more progressive. So
yes,
we want to keep it simple. And, there's other methods, feel away and other things like that, especially when the cat comes to see me, because some cats just coming into a veterinary office, they get aggressive just because they're in a different place and the
Sure.
smells are
yes.
different. So
Wait.
yeah, so I always take it in the context of what, the history is and what's happening exactly.
We like some holistic remedies, or even gabapentin short term,
Oh
Yes.
gosh, yep.
more than the long term. Because
Love
the thing
gabapentin.
too with Prozac, it takes so long to titrate up. By the time
Yep.
you see if it's going to make an effect, right?
That's it.
Oftentimes the person's given up and said, forget it. I'm just going to put this cat in the shelter.
Yeah.
Oh yeah,
And,
yeah.
one of the huge catalysts, if you'll excuse my pun,
Arr.
right now that we're seeing are feral cats. Somebody's cat has lost
Yes.
their mind and is being aggressive, and the doctor has given them fluoxetine, Prozac, and there's cats outside, and we get rid of the cats, we
Yeah.
get rid of the problems. Now we got to titrate back off of this antidepressant, and the cat wasn't depressed. They were trying to protect their home.
Yes. Yeah. Displaced aggression. That's huge.
Oh, yeah.
And,
Oh,
That's a big one.
it's, you have the screen and the kitty sees another kitty outside, and all of a sudden they turn into some sort of monster when it's really not
Yes.
them. It's just their reaction to, think about a person just reacting to someone lurking around outside.
We
That's
often
what I
say, we
always
often
say.
do
I
relate
tell
those two
clients,
things.
okay, imagine you just heard on the radio that one of America's top 10 most wanted has escaped from prison
Yes.
and was seen next door to your house. How are
What are
you
you
going to
gonna do?
react?
Exactly.
Your partner walks in the room, you're going to cuff him one because you're so
Yeah.
on edge.
Oh,
Yes, that's
yes.
how your cat is living. The
And that's your
boogeyman is at the
brain's,
door.
yep, brain's natural reaction to
Fight or
something
flight.
scary is fight or flight,
Mhm.
and I think cats are like that. They'll be at stage
100%.
1 and then all of a sudden they're at stage 10, so
Yes. Yes.
They may not
it's
even
such a
need to
big deal.
see the cat, just smelling them outside.
Smell it. Yep.
Yes.
And
Yeah. Been there, done that one. Yes.
yeah.
What
Yeah.
other things should we be looking out for, Dr. Karen, as far as neurological issues with cats?
I would say, certainly we look at behavior like you guys mentioned, but if we see circling or a head tilt, if the head is tilting like this, that probably could mean that we have an underlying problem with our ear, our inner ear, middle ear, what we call vestibular disease. Our balance system is off, much like if we have an ear infection or we have vertigo. Kitty
Yes.
cats will get vestibular problems. So anything with that or circling or behavior changes. So if your kitty's not as affectionate or is not as responsive, or if you rattle the snack container and your kitty doesn't come running like most cats will do, that could potentially be an issue neurologically. But again, some cats that are painful may act the same way, but it's the repetitive abnormal behaviors that we
Okay.
get worried about. Exactly.
Yeah. Especially when they aren't relieved by anything. And they,
Exactly.
yeah.
What
Yes.
about What about cats like Pepper, Linda? Do you want to talk about Pepper? I really think that cat had a neurological
Pepper,
issue.
I do too. Pepper was a client cat when Rita had the cat sitting business and I worked with her. And Pepper was a spicy girl. She only liked her daddy,
Of
no
course.
one else. And I mean, would attack. We had one sitter that
Attack.
would take care of Pepper because she could see through to the wounded kitty that was, but they literally
They
left a
left a
broom
broom
by
by
the
the
door
door.
so that she
Oh my
could reach
gosh.
around and scoot the cat back. And she was very, very purposeful in her movements and what she did and how she did. She had to lock herself in the bathroom when she was scooping the box because she'd get attacked. And
Oh
it was
geez.
so, and I mean, for years, this has been going
Mhm.
on. And God bless this guy. He's like totally given up his love life
Yeah,
to
he couldn't
take
have a
care of Pepper.
relationship.
He can't have anybody in the house. Pepper will eat their face.
Oh geez. That's
Nothing helped.
crazy.
I really think it
Yes.
was a
Oh
neurological
wow.
issue.
Yeah.
Well, could have been. And again, sometimes, like I mentioned, seizures, weird seizures, because cats don't sometimes have, paddling as a function of seizures. It can be more of a focal type of situation where they twitch a whisker or an ear, and that's
Mhm.
all they're doing. And then post seizure, they're kind of crazy and
Oh,
aggressive
yeah.
sometimes
Oh, do
too.
cats do the postictal thing?
Yep, they can. They can. And I tell people to be very, very careful because just like in dogs, they don't know what they're doing. They may scratch, they may bite, especially with
Mhm.
children in the house and everything. It's a scary situation.
That's
And
Yeah.
good to
sometimes
know.
cats will attack each other because, the normal cat will see the poor seizuring cat as some sort of aberrant creature and they'll
Mhm.
start fighting. So it is a very big deal to not intervene right after, but to keep them in a small enclosed area and not let them hurt themselves either or
Yeah.
anybody
Linda's
else.
daughter
Yes.
has seizures, so she knows
I've
the
lived through
composition of a
postictal.
seizure.
It's
Oh,
insane. I
wow.
mean,
Yep.
insane. Like,
Yep.
I need to go see my mom. I am your. I
Oh,
mean,
oh boy.
literally, we have been through some stuff, but fortunately, thank you, God, it's under control right now.
Oh,
But there were
good.
some moments where I felt like I was battling somebody on bath salts.
Oh, jeez.
She's
Yeah, it can.
strong too. She's abnormally strong when she's
Yeah,
post
yeah,
seizure.
Oh,
adrenaline,
wow.
that whole,
Wow.
like, when moms lift cars off of their children and
Yep.
things,
Yep. The
Yeah,
superhuman
yes,
effect. Yeah.
yes,
It's good to
Yep.
know that
Exactly.
that happens
yes,
to cats too, because we could get a lot of people that all of a sudden one cat attacks the other, seemingly for no reason, even though they may be siblings that go along for years. We
yes,
Oh,
usually
yeah.
attribute it to outside cats or some kind of anxiety going on, but could well
yeah,
be some type of seizure abnormality happening.
Oh, yeah. Yeah, and that's where looking at if they're abnormal in between the events or something like that, and owners are the best judge of that because they live with them every day. So it's just like, and that's where I start with the history because 9 times out of 10, getting that history is going to tell us a lot more about what choices we have for treatment.
yeah, yeah. So if, let's say my cat loses their mind, acts up, chomps on me out of nowhere, but then it doesn't happen again, it's been a couple of months. Could this be a neurological I mean, how far apart can seizures be spaced?
Oh gosh, that's a really good question. Sometimes they can have multiple in a day, or sometimes
Wow.
we can have them once a month, once every 3 months. I tell my clients it's very unpredictable, and that's the tough part. But when we intervene, sometimes with medications, is when
Mhm.
they, are occurring on a daily basis. I've had a couple of cats come into an exam room and they're actively seizuring and having like 65 focal seizures in 5 minutes. And the
Wow.
reason owners bring their cats in is because they're behaving weirdly or badly, and it's because they're persistently having seizures. And you get them on a certain treatment regime if you've ruled out anything else systemically, and they're back to normal. So I think it's important again to use those powers of observation and really watch your patient. And
Yeah.
that's what's so cool about neuro is you can tell a lot of times what's wrong with them, again, just by observation.
Okay.
And
Yeah.
realize that there is treatment
Yeah.
that
Yep.
cats
Rita's,
can
Yep.
recover. I was laughing at
Ah,
your cat because he was doing circles back
was he
there,
doing a
but he
circle?
does
Yeah.
not have a neurological
No,
issue.
oh, he's got something. Rita's cat Simba is 4 years old and she's never, well, he can be a
He's
pain in the
probably getting
butt, but
close to
he's not
five
had
now.
any crazy things. couple of months ago, out of nowhere, he bit her arm so bad. She's still got scars out
Oh,
of nowhere.
no.
And I mean, chomped.
He
Now he
just
hasn't
sunk
done it
in.
since.
No, out
Yeah.
of nowhere.
We had just lost a cat, so we were trying to blame it on that, even though that didn't really feel like it
I don't know
rang
what it
true.
was. Maybe it was a seizure.
So that's why I asked. It was about Simba. I was thinking we should keep an eye on this, because if it happens
That didn't even
again,
dawn on me.
maybe these are spaced out seizures, or maybe that one happened while she was in proximity, which is why she got bit, and she's missing.
He was sitting
others.
on my lap quietly, and all of a
Oh,
sudden
boy.
sunk
Wow.
in. Now, are there
Wow.
markers? Like, can you tell that a cat has had a seizure in the past, or is there no leftover evidence?
Unfortunately not, and that's the thing. If only our patients could tell us exactly what was going on, but we just don't have that luxury.
Mhm.
Yeah.
But they can happen out of the blue, but I would monitor it. It's possible it may never happen again, hopefully, but it does make you a little wary and
Now, for about a
scared,
week, whenever he'd
you know?
come up to me, I'm like, I don't trust
Oh
you. I
my
don't trust
gosh,
you.
yeah, yeah.
Yes. And we're like, when you've lived with them for 4 years and nothing like that's ever happened, it's
Yes.
like something's up.
But he's very sweet normally.
Yes, he loves her.
A little
but
derpy, but he's sweet.
yeah,
That's okay. We all are.
bit of a
In our little
troublemaker,
ways.
but yeah, but he's a love. We love them despite it. So
I know we're coming up to the end of our program, sadly, but we would love to have you come back. Are there any last things that you would like our audience to know about neurological issues, or things they should be aware of?
Yeah, and as I had mentioned before, I think sometimes little cats get the bad end of the stick in terms of, especially if they're having seizures or whatnot, it doesn't necessarily mean that they have something bad. So I think, just getting to your veterinarian, if they recommend a specialist consultation, at least going in there with the mindset of what are my goals, what are my expectations, maybe it's not going to be bad news at all. So we just need to make sure that, we all work together, because at the end of the day, healthcare can be really expensive. But
Yeah.
first and foremost, if we need a specialist examination, they're going to just guide you through the process and make sure you're comfortable, and then be there to follow up with you as time goes on. Absolutely.
amazing.
Awesome.
Thank you.
I can't thank you enough for being on our show.
You're very welcome. It was great to
Oh,
have you guys.
We have a lot of
or see
topics
you
lined up
guys.
for you.
Yes.
You
Yeah,
wanna go
we're gonna
back?
have you back. We are
That
not
sounds
done
good
with
to
Dr.
me.
Karen. Good.
And
Good,
if you
Love
happen
to
to
come back.
If you happen to be in
Really
the Charlotte
appreciate you
area,
having me
anybody?
on.
Oh,
Yeah.
yes, definitely. Anybody who's listening, if you're in the Charlotte area, Care Charlotte, there's a couple choices in Charlotte. Care Charlotte, they have the best staff. They won't charge you an arm and a leg. Dr. Faber is an amazing neurological
Yeah.
specialist. So I would implore you, have your cats checked out.
Yeah.
Linda, as always, thank you for being my ride or die, my BFF, my work wife as her husband.
Yes,
calls you.
definitely. Definitely.
Dr. Karen, thank you so much for your time.
Yes.
You're quite
And-
You're
welcome.
amazing.
Absolutely. Absolutely.
Mark
Thanks
Winter.
for having me.
Oh, it's our
You're so-
pleasure. We
yeah.
can't thank you enough.
Beyond. Yes.
Mark Winter, thank you so much for this space on Pet Life
Yep.
Radio, and for your awesome editing, making us sound so good. Just remember, everyone, every day is Catterday. We'll see you next time.